All right, today we're going to tackle a really interesting topic, salivary gland tumors. We're going to break down what they are, where you find them, and most importantly, the key differences you absolutely need to know.
So have you ever wondered what really separates a minor issue from a major one when it comes to these things? Well, the answer is kind of fascinating, and it lies in this surprising little rule. It turns out, with these tumors, size and risk are often completely flipped from what you'd expect. We're going to get to that in just a second.
Okay, so here's our game plan. We'll start with the big picture of the salivary glands themselves. Then, we'll get into the common benign tumors, and after that, the malignant ones and their warning signs. We'll wrap up with how they're diagnosed and treated, and of course, the key things to remember. Let's jump right in.
All right, first things first. Before we can even talk about the tumors, we've got to understand the glands themselves, where they are, and a pretty surprising rule that governs them.
So check this out. A whopping 70%. That's the vast majority of all salivary gland tumors pop up in the parotid gland, which is the biggest one we have. Now you'd think, okay, biggest gland, biggest problem, right? But that's not exactly how it works. And here is the really counterintuitive part. It's the big idea you need to grasp. Even though the largest glands get the most tumors overall, it's actually the smallest glands that have the most dangerous ones. Yeah, you heard that right. It's a total inverse relationship between the size of the gland and the risk. And this chart just lays it out perfectly. Look at the parotid gland, the big one. 80% of its tumors are benign. But then you look at the tiny minor salivary glands and the numbers are completely flipped on their head. 75% are malignant. So the key takeaway, the rule to remember, is this. The smaller the gland, the higher the chance that a tumor inside it is cancerous.
Okay, so with that rule in mind, let's start with the good news first. We're going to dive into the benign tumors, the most common players on the field.
So, if you had to guess, what is the single most common salivary gland tumor overall? Any ideas?
The answer is pleomorphic adenoma. You'll hear this name a lot. It is the main player when we're talking about benign salivary tumors.
So what is it? Well, it's a benign, slow-growing tumor. People sometimes call it a mixed tumor, and that's just because under a microscope, it looks like it's made of a mix of different cell types. It's really the classic example you think of for these glands, the most common type by far.
So let's build a quick profile of this thing. It's typically a painless, slow-growing swelling. We see it a bit more in females, usually around age 40, and its favorite spot, the superficial lobe of the parotid gland. Now, here's a really important detail. While it's benign, it has this small, about a 3 to 5% risk of transforming into a malignant tumor down the road. So it's something you have to watch. Okay. Next up, we have the runner-up for most common benign tumor, the Warthin's tumor. And this one has a very, very specific personality. It's almost always found in older male smokers, and it pretty much only shows up in the parotid gland. And get this, in about 10% of cases, it's bilateral, meaning it can show up on both sides at once.
So let's put these two side by side. It really makes the differences pop. Your typical patient for a pleomorphic adenoma is a woman around 40. For a Warthin's tumor, an older man who smokes. And here's the absolute biggest difference, malignant risk. The pleomorphic adenoma has that small but real risk of turning bad. But a Warthin's tumor? Never. It never turns malignant. That's a huge distinction.
All right, so we've covered the benign players. Now we've got to pivot and talk about the malignant tumors. This is where we need to pay close attention to the warning signs.
And this quote right here says it all. Pain and facial paralysis are rarely found in benign tumors and suggest a malignant lesion. This is probably one of the most critical things to remember. Benign tumors usually just sit there, slowly growing, not causing much trouble. But if you start to have pain, or worse, weakness in your facial muscles, that's a massive red flag for malignancy. So here are the signs that should really make you suspicious. A lump that starts growing fast, one that feels hard and seems stuck to the skin or the muscle underneath. Any kind of pain, especially if it shoots up toward the ear. And then the big ones, any weakness or paralysis in the face, which points to the facial nerve being involved, or numbness, which could mean other nerves are being invaded. These are not things you ignore. So who are the main bad actors here? Well, the most common malignant tumor is called mucoepidermoid carcinoma. But maybe the most sinister one is the adenoid cystic carcinoma. Why? Because this one has a nasty habit of invading nerves. It's called perineural invasion, and it means the tumor literally likes to track along nerve pathways, which makes it incredibly difficult to treat. Okay, so we know what to look for. Now, how do doctors actually figure out what's going on and what's the plan of action?
The diagnostic pathway is usually a pretty clear two-step process. Step 1 is something called a fine needle aspiration cytology, or FNAC for short. It's the first-line investigation. They use a really thin needle to pull out some cells for a quick look. Then step 2 is usually an MRI. That's the best tool we have to see exactly how big the tumor is and if it's spreading into any surrounding tissues.
Now here's a really important point. You might think, why not just do a regular biopsy and cut a piece out? Well, for parotid tumors, that's a big no-no. An open biopsy is almost always avoided. The reason is to prevent something called tumor seeding. You don't want to accidentally spill tumor cells and give them a new place to grow. It's a huge risk, and that's exactly why the fine needle approach is the way to go.
And when it comes to treatment, the philosophy is night and day depending on whether it's benign or malignant. For a benign tumor, the goal is simple: get it all out. A complete, clean removal of the tumor while being incredibly careful to protect the facial nerve. But for a malignant tumor, the approach is much more aggressive. It's an en bloc removal, meaning they take out the gland, any involved structures, and the nearby lymph nodes all in one piece. And the nerve, it's only saved if it's absolutely not touched by the tumor. Plus, surgery is often followed up with radiation just to be safe.
Okay, that was a lot of information. Let's boil it all down and wrap up with the most important takeaways.
So here are the crucial points you need to walk away with. First, most salivary tumors show up in the big parotid gland, and thankfully, most of those are benign. Second, and this is the big one, always remember that inverse rule. The smaller the gland, the higher the risk of it being malignant. Third, think painless and slow-growing for benign tumors. And finally, number 4, the red flags for something serious are pain, rapid growth, and any kind of facial weakness. Those are the